Good morning, everyone. Lovely to have you here. We're expecting more people to join us, but will we get started? Yeah, we'll get started anyway. So thanks very much for joining us today for an interesting discussion to come around transformation in our social care system. I am Sheena Arthur and I'm Partnership Manager at GCVS for Health and Social Care. And when getting ready for this session, I was just reflecting on how difficult it is right now to think about is there anything going well and how challenging it all is. But there's really a plea to think about what we can do and how we can work together. And I think today, if we can really be present and listen to our speakers, because we've got an amazing opportunity to hear from them today. And I was also reflecting on, and I want to thank my colleague Lynn, because she finds amazing people doing their stuff out there in the community, and it's a real opportunity for us to learn and develop together. So I want to thank Lynn for bringing us all together today. We've got Sarah Cowan, coordinator at Scottish Women's Budget Group, who are an analysis and campaigning group and really looking at the gender analysis in public policy and funding decisions, and working with a range of women across Scotland who have an interest in women's equality. And we know that there is a gender issue within our social care system. So really delighted to have Sarah here to tell us about the report that she has created with her colleague, and is going to dazzle us with figures, I think, but also going to make it possible for us to understand what it means and what the opportunities are. And we also have Fiona Colley from Carers Scotland, who's going to join us later on about what's happening in practice on the ground and what her insights are about what's possible as well. So really great to have that dual perspective. We will have a chance for questions and discussion. So please do feel free to use the chat, and you've got icons at the bottom, chat, and also there's reactions if you want to put your hand up later when we get into the discussion bit, please do. Also, if you want to put comments or questions, Lynn and myself will keep an eye on that and bring you in at the appropriate time when we've got time for questions and discussion. And thanks to Sarah and Fiona for being open to that. When looking at the report, the thing that really struck me was there's a bit that says, we know about the National Care Service and the intention within that, but transformation will only come when care is properly valued and invested in, with people's human rights at the forefront. And I know from our previous discussions that's something that we are interested in and want to know more about. And that's why we're here today. So thanks to Sarah. I'm going to pass over to Sarah, who's been campaigning, involved in social justice and advocacy, and delighted to have you here, Sarah. So thank you. I'm not going to waste any time chatting on here. Pass over to you now. Thank you.
Thanks, Sheena, and thanks everyone for joining us today to talk about this research. As Sheena's already said, my name's Sarah Cowan. And I'm the coordinator for the Scottish Women's Budget Group. And as a brief background on the Scottish Women's Budget Group, we work to promote equality through gender budgeting to build a fairer and more equal Scotland. And we do this through training, advocacy and research. And today's event is an opportunity for us to share our most recent piece of research, looking at what is needed in terms of investment to transform Scotland's social care support services, to better deliver for those who rely on them and for those who work within the system. So before I get into the findings, and as Sheena says, there will be some numbers to share, but I'm trying to make them as approachable as possible. I just wanted to set out a little bit of context about why we undertook this work. And I'm just going to share my screen as well so that I can share a few slides. I presume someone will shout if you're not seeing slides. I just need to make it go into slideshow. There we go. So the Scottish Women's Budget Group has long called for greater investment in care as part of our feminist analysis of the economy in Scotland. And the aim of this research was to put some figures next to what we mean by this more investment and what is really needed to create change. And that kind of change that we're looking for is to expand the reach and quality of care and improve pay and conditions for care workers, as well as reduce reliance on unpaid care system, a reliance which is inherent within the current system and the current amount of funding provided. Long-term underinvestment and undervaluing care is a hallmark of most economies, and Scotland is no different. This has meant that services are understaffed, with recruitment and retention difficulties at current pay levels. People are unable to receive the care packages they need, with wider needs, unmet needs unknown. And people's human rights are not being met, and there's a lack of adequate investment, which means that unpaid carers, the majority of whom are women, are left to fill in the gaps. This long-term underinvestment can be seen as both a cause and consequence of gender inequality, with care work seen as women's work, with deeply entrenched stereotypes, meaning kind of that this undervaluing of care work to see it either as low-paid work or unpaid work, rather than recognising the role care plays in the good functioning of our economy and society, as well as for us all as individuals. For too long, funding for social care has been seen as a cost rather than a vital investment in our economy and society. And at Scottish Women's Budget Group, we view social care as what we call critical social infrastructure that requires investment. So just like the physical infrastructure we all rely on, social infrastructure is something we all rely on and needs to be provided. And just like roads, bridges, and building projects, investment in social infrastructure can also create jobs and returns for the economy. We were pleased to see that the Scottish Government has started to recognise this funding as investment within some of the National Care Service documentation. And this is a really necessary and critical step for the government that needs to continue to be built on. The Scottish Women's Budget Group undertook this research at an important time of focus on social care in Scotland with the development of the National Care Service. And the focus on the National Care Service demonstrates political recognition on the need to change Scotland's social care support. While there is still much clarity needed on what this National Care Service would bring, and that's possibly quite a big understatement, what we are clear on, and as highlighted in the introduction, is that there is a need for more investment, whatever structures are in place. And our modelling was developed using existing data on costs and hours of care delivered. So no matter what structures are brought in or changed, the investment we highlight is needed to ensure transformational change is brought about. Any costs to new structures that might exist on top of this for a National Care Service would be on top of what our research finds. And yet, despite this political focus, our research is also published at a time when social care is in a critical state, with staffing shortages, winter crisis pressures being highlighted throughout the media regularly through at the beginning of this year, and new reports coming out highlighting cuts in services faced by disabled people since the pandemic that haven't returned to pre-pandemic levels. So there's no space for short-term fixes. Just last month, Glasgow HSCP announced millions of pounds of cuts to social care services, causing worry and stress for those who use the supports or are seeking a care package and those in the workforce. In responding to the news, Glasgow Disability Alliance has highlighted what it would mean for some of their members, and I can share a link to that in the chat later. And maybe it's something we might want to pick up in the discussion later as well. There might be others on the call who want to say more about that. These can also seem confusing when at a national level, last year we were told in the resource spending review that there would be more funds for social care in this parliamentary term. However, growing inflation, rising costs have all but wiped out these promised increases. And we also saw what was called reprofiling taking place in last year's budget, which moved money out of social care. One challenge we found in researching this care report and care funding generally is the ability to follow the money from national commitments to experience people have of care and what it means to funding that's available locally. And while we recognise this is a time of constrained finances, that can make calling for greater investment difficult, our research shows that greater investment also brings back to the economy. And that's why it's important for us that funding of these kind of social infrastructure projects are seen as investment. They're critical for us as a society and economy and not a nice to have. It's also worth highlighting, although I'm sure people on this call will already recognise, that those in receipt of social care support can be amongst the most at risk to shocks with the cost of living crisis, and cutting services at this time will only make the impact of rising costs harder to bear. So despite challenging budget positions that government may face, now is very much the time to invest in care. And I hope I'll share some ideas at the end of where money can come from, as well as sharing some big figures that we would like to see that investment reach. So, on to how we did our calculations. And firstly, I want to credit the work on calculations and modelling to Dr. Jerome Dehanau, Senior Lecturer at the Open University, who worked on this project with us, with some additional support from Professor Suzanne Himmelwaite. This research would not have been possible without their generous support. So in terms of our modelling, it was built on a similar project undertaken in England. And occasionally there was data for Scotland that was not available. And when this was the case, we made assumptions based on data available in England and what was available in Scotland. But it also meant we were able to compare and cross-check our results to what was found in the English modelling. So we based our modelling on an understanding of current care support received and needed, looking at those with substantial needs who should, in the current system, be receiving support, but we know that there's unmet need, so that that people aren't always receiving the support that they should be. As we've kind of alluded to already, there's a risk my presentation could turn into me just sharing a bunch of numbers. I'm not going to go through each of the numbers that I'll share on the next screen, next couple of slides. But the detail for every number on the screen and all the tables is in the research report, particularly in the appendix, if you're really interested in how we came to the calculations. And I'm happy for anyone to come back to me either in the questions or after today's event if you want to discuss a bit more detail around these figures. So in terms of establishing care support received and needed, we used sources. I think the important thing to highlight is that sources we were using were from Public Health Scotland, the Health and Social Care Experience Survey, and the Family Resource Survey to establish our understanding of care and support received and needed. We wanted to establish both support around substantial needs, people with substantial needs requiring social care support, but also for those with moderate needs to be able to expand the social care support system to a wider range of people, providing support earlier so that many people can live their lives to the fullest and hopefully avoid later crisis interventions and support coming in at that crisis point. And we used those sources to kind of be able to establish the numbers that we were looking at, which came out to proportions that are available, that can be demonstrated on this table. And just to highlight that the darker pink is demonstrating those people with moderate needs, so where we'd be looking to expand people who access and that's access care, and the lighter pink are the substantial needs, so people who should already be receiving support, as well as residential care being in the orange slide, the orange cover, and just put in a comparison to England on that slide as well, with slight differences in Scottish numbers relating to population health. We calculated the hours of care needed based on current delivery levels, good practice laid out by the Home Care Association, which builds in time for commuting, training, holiday, sickness, and admin time. And that is demonstrated on the table on the screen just now. And with these figures, we then went on to establish two scenarios of what we see as the funding requirements within Scotland. Firstly, a core scenario, which we believe is the minimum amount needed for Scotland's social care support services. So a minimum as in terms of an increase from the current service, the current funding levels. And then we calculated a more ambitious transformative scenario, which we believe is what is needed for a more proper valuing of social care. And just to be really clear, the transformative scenario is the scenario we are most advocating for, but the core offers an option as a way to get there. So within the core scenario, we'd be looking at an increase in wages for social care staff. The research was done before the most recent real living wage increase, so that's where the £10.50 figure comes from. This wage increase to £12.50 is a number, again, taken from the Home Care Association and what they rate as necessary for competitive wage levels. The increase in coverage that we'd like to see within the core scenario would be to deal with the current unmet need that we see in social care support services. So we estimated this as a 19% increase needed based on the data that we had as outlined in the previous slides. The transformative scenario, however, goes a lot further, and as I say, is our ideal scenario and what we think is really necessary for Scotland to be aiming towards if we want to have a proper, universal, accessible social care support services. So this would see a more significant increase in wage rates, moving up to £15.21. That number comes from kind of matching in good practice in Scandinavian countries, where social care workers receive wages that are in line with about 75% of nurses' salaries. Alongside this, there's a corresponding training upgrade for the workforce as well. And it sees a very significant increase in coverage, partly to cover people with moderate needs, as I've outlined already, also because there would not be unmet needs within the system, so it's taking on the increase in coverage that we have in the core scenario. And finally, we built in an increased take-up rate of social care support that we assume would be seen based on some findings around increase in take-up when free personal care was put in place, but as the quality and accessibility of care improves, then we assumed that take-up would also improve, as people would want to take up the service. Under both the scenarios, and something we costed in was another couple of points, preventative nurse visits to all those who are 75 years and older, twice a year. Again, this was taken from good practice in Scandinavian countries, and I think in particular in Denmark. And this is again about trying to avoid that sort of crisis intervention point and being able to support people at an earlier stage, or identify where more supports might be needed. And that both personal and household tasks would be free at point of use to all recipients. So this means that both our scenarios have costed in an end to any social care charges, and that all social care would be provided free at point of use in the same way that healthcare is. Of course, both of the scenarios require greater investment than the current system. And the numbers I'm about to share can look really big, but it's important to remember the point I made earlier, that social care has long been undervalued. So placing a value on social care will appear like a big step, but we must remember that it's a long overdue step. So this graph shares, and yes, as trying to avoid going through too many of the numbers, but this graph highlights that the current investment levels in social care of £3.5 billion from the Scottish Government. The core scenario that I outlined would require £5.1 billion. So that's about a 50% increase in the current budget for social care. The transformative scenario would require £6.8 billion, which is about as close to doubling, a little bit less than doubling the current social care budget. But I'll come on later to where there's also returns back into the economy. The graph and the ones available in the report as well do the same sort of breakdown, showing what part of these increases are related to all care being free, for example, improved coverage, improved pay, which means that if you were advocating for one part of the system and it was useful for you, there is a breakdown in terms of graphs as well in the research report, so that you can see how much exactly is needed for example, the pay uplift, and only doing that part of the scenario. Although, just to be clear, for the Scottish Women's Budget Group perspective, we think the ideal would obviously be the move for everything, for all parties to be moving forward at once, so that we could see the overall improvement to social care. And it is worth remembering that the government commitment last year to increase in funding was a 25% increase in social care funding. So they have recognised a need for some level of increase, and our research finds that needs to go significantly further. But these numbers won't stay static either, and our research shares a 10-year projection, so that if our advocacy efforts for increased funding turn out to be long-haul efforts, then the overall numbers we're looking for, the kind of real numbers, when I said 6.8 billion, for example, for the transformative scenario, these will go up over time, and we won't be, in 5 years' time, we won't be calling for the same amount. We'll need to be looking for higher amounts. So those numbers are available in our research as well. As I've been trying to highlight, this funding is investment. And so we modelled also what job creation would come from this investment as part of our research, and to try and help with this argument for increased funding. So we often hear on building projects, private partnership investments, how many jobs this will bring to the economy and how this investment is needed to kickstart our economy, for example. Well, the same is true in care investment, but too often these elements are ignored. Is this because they're primarily women's jobs? I'll just leave that question out there. So jobs are brought about through the increased investment. Jobs are brought about in 3 different ways. Directly by employing more carers, which can be seen in the dark pink. Indirectly to industries that support care work. For example, provisions that are needed within care, which are demonstrated in the light pink. And then induced jobs, which means jobs that are created locally because there's more waged people on better wages being able to spend in the local economy. And they're demonstrated through the orange block. So we can see that the transformative scenario, the much higher investment, does bring much more significant returns in terms of employment creation as well. And with more jobs comes higher tax revenue. So tax returns reinvested in public services mean that the big numbers I spoke about a few slides ago are brought down slightly. So, and to not, hopefully not, this is the final set of numbers as well. In the transformative scenario, increased tax returns cover almost 50% of the additional investment required. So that wouldn't be available in the first year of the investment requirement, but as an ongoing basis, that return means that what we're looking for in terms of additional investment from government does come down. And so while the amount of new money needed is still significant, it's not as vast as it would first appear when you hear the scenarios. And we have some ideas about how some of this new money could also be found. But it does require political commitment and decisions on where the money will come from to bring the necessary focus to social care support. So we think this could include raising more revenue, and this should be seen as central to the Scottish Government's commitment to a wellbeing economy which cares for both people and planet. There was a recent report by the STUC which highlighted tax options for investing in public services, some of which could be implemented quite quickly. And they've launched a report at the end of last year saying that some of their ideas could be implemented by April this year. So there's some options that are quite quick turnaround. These options include looking at wealth taxes, at land value taxes, and at a longer term option, but a long overdue option of overhauling local taxation to build a more progressive tax base in Scotland. So we believe it would be important for additional revenue to be raised within Scotland to be invested in social care support services. But there's also areas in the current system to review at where the money is going that is currently invested. For example, profit extraction from care services, and phasing out profit extraction as part of long-term moves would be another option to ensure that money invested stays in the system and it reaches people who are being supported by social care services. There's also current practices such as the use of agency staff, which are costly and a symptom of staffing challenges in the current that's faced by the sector. With greater investment, we'd hope to see a more stable workforce in place and reduce the need for agency services and costly system fixes that are currently in place. And finally, and maybe a bit techie from the Scottish Women's Budget Group perspective, but Scotland's borrowing powers are currently limited within the fiscal framework, which is an agreement that we have with the UK government on how our budget can be set, and which is why we often hear Scottish Government ministers talking about Scotland having a fixed budget. However, this framework is under review at present, and there's a case to be made that some borrowing powers that could be used to invest in social infrastructure projects could be extended into that fiscal framework. Currently, the limited borrowing powers that are available to the Scottish Government are reserved only for capital projects, which are more likely the physical infrastructure that I've mentioned. So yeah, that might be a slightly more long shot option, but I think it's an important place to be also having a conversation on social care and investment in social infrastructure. Under investment in Scotland's social care support services is cost in Scotland. So it's time that we change that. And we hope that the scenarios that we offer within this research are both a demonstration of what's needed to bring about universal, accessible social care services, but also should be seen as achievable in Scotland. And it would be great to hear your thoughts in the discussion around this. I just want to end on a few thoughts on kind of what you or we could also do next to, and again, we can come back to this in discussion. There's currently a campaign called the Scotland That Cares, which is looking to better value care in Scotland's national outcome. And if you check out the website link there, and I'll put it in the chat afterwards as well. There's currently a review of Scotland's national outcomes, and our budget and investment should be directed towards supporting those outcomes. So we need to ensure that care is properly highlighted and valued there. And through that campaign and other ways, you can share why you think care should be better valued and the difference it would make to you or someone you care for or those you work with. If you're involved in discussions around the National Care Service or advocacy meetings around social care, raising funding levels, and feel free to share our findings, look for parts of the findings that best support your arguments, and ensuring that in the conversations on the National Care Service, investment remains a critical part of that, and not just investment in new structures, but investment in the provision of care. And I hope that the next stages of this this call, but ongoing from that as well, that we can keep the conversation going about how this investment can be brought about. I will leave my presentation there, so I'll stop sharing the screens.
Thank you very much indeed, Sarah. Lots to think about and some real key points coming through for me about that investment and return. So actually that investment will create opportunities. And for me, there's something about seeing the whole system. So I love that you said if you're only interested in the wages increase aspect, because we know the system doesn't look at the whole. That's one of our issues when we're working together. So thank you for highlighting that. I'll give people time to put some questions in, but we've got one. Wendy Henderson had asked, could you maybe tell us a little bit more about the reduced profit extraction that you mentioned?
Yeah, sure. So this is in relation to private providers within social care, and the profits that they will be taking from the care that they're providing as part of what they're doing as a private provider. We would ideally like to see a social care system that provision is from public and voluntary and not for profit sector, so that any money that's going into the system is being used to provide social care support and not being used to create profits for individual companies. The STUC, again, have done a bit more research on this, and have highlighted both the fact that provision within the private sector, there's downsides in terms of concerns about care provided, as well as workforce issues, and more likely to be using temporary or precarious work kind of contracts. So there's some evidence there, and the UK Women's Budget Group has looked at the UK as a whole as well, at how some of these private providers can operate. And I can share a link to that one. It's arguably less of an issue as in England, but it's still an important issue that we look at and try and keep all the money that's invested into social care going to the kind of aims and support that social care should be providing.
Great, thank you. Just want to check with Wendy that answers a bit. Lynn's looking for some more info to share on that as well. Is that okay, Wendy?
Oh, I managed to unmute myself.
Oh, good.
I work with the Scottish Borders Health and Social Care Partnership. I say work with, it's Partners for Integration, which is a Scottish Government's initiative to support the integration of health and social care. So I'm the voice of the external providers within the strategic plan and structures, which includes third sector, voluntary sector, not-for-profit and private. And I think in terms of private, or the use of the word private, services that are commissioned by partnerships to deliver care are commissioned at a particular rate, which is currently the £10.50 per hour, soon to increase to £10.90 per hour. And I think it would be really helpful to do, there's a bit more discussion to be had, because if you would speak to the providers, they would tell you that they're not making any profit from what they're funded through the public purse. And in fact, many are changing their models as the largest. They're also the largest provider of care. Collectively, they're the largest provider of social care in Scotland. So in the Borders, 75% of the residential beds are provided by the private sector. And that's a common number amongst all partnership areas. And there's a huge reliance and dependency on the external providers because local authorities, partnerships can't afford internal. So it's an interesting dialogue that's appearing, which is, and we've heard discussions down in England about a two-tier system. People who can afford to pay, £1,800 a week, self-financers are actually the ones that are subsidising the council placed residents or the council care packages because of the amount that's being paid. So it's just an interesting dialogue to have when there's a real argument that this is about people profiteering, when actually the experiences are we've got businesses who are about to go under. So the demand on local authority is going to be higher. Therefore, the cost to the local authority and the partnerships in the government is going to be higher. Or the unmet need increases.
If it's okay to come back a little bit as well, I think there's an important distinction when we're talking about private sector as well, in terms of small private providers that might be in a specific local area, and some others which are more connected to multinational firms, of which there is a lot less in Scotland. So that's where I was trying to draw the distinction to some findings that there might have been in England as well, where there's a bit more of that large scale private providers. So I think that's right, Wendy, in terms of it's a more nuanced discussion than my couple of lines there probably allow for, and an important discussion to have. And I would also add, I suppose, that what we say around reducing any profit extraction would be looking at kind of long-term changes rather than any dramatic shift to say move completely away from private sector, because as you said, the current model has a reliance on that. I've got the I'll share I'll share a paper from the UK Women's Budget Group that looked at the UK as a whole. So as I say, it looks at the more at the bigger kind of private firms, and just goes into a bit more detail about how some of that profit extraction can be done in a way that doesn't necessarily always just look at profits on a balance sheet, but looks at who owns the land that the provision is, for example, the care home is on, if rent's being provided to a backing company and that sort of thing. So I'll just put that in the chat bar as well.
Great, thank you. Thanks for that important point, and for responding. And it does bring in the issue around choice, and you know, there's different specialists providing care that is really, I think, about the money circulating within social care, isn't it? So a not-for-profit is one aspect of that. Please do put, we've got another few minutes. We're wondering, Sarah, if there isn't any other questions coming in, was there any look at, you know, reduction in costs elsewhere? You know, you've talked about the spend, the investment and the return, and almost 50% return coming back into the system of increased employment, taxes, etc. Was there anything around savings, you know, if our social care system was better valued and invested in, the impact on hospital, for example, the hospital setting?
So the short answer is no, in that we didn't model that sort of saving, because it would have been based on a lot of assumptions, because we don't exactly know what would happen. But yeah, we do assume that there would be potentially significant savings, as I mentioned a couple of times, being able to avoid people reaching the need for crisis intervention, and that likely to be a hospital stay, or potentially be a hospital stay, or a more significant input. If the social care support is provided at the earlier stage, then we would hope and do make an assumption that there'd be a saving there in other budgets. But we didn't model that. I think that don't know if others on the call might know. I think other organisations have looked a bit at that, and I think the two combined could be really useful. But yeah, we didn't add it into our research.
Okay, thank you. There was an invitation earlier, you were talking about the impact on people with disabilities, so I'm not seeing anything in the chat, but that might come through later. And also there was something around, you know, the opportunity for carers. If there was more investment, there'd be an opportunity for a lot of our unpaid carers to have, for example, to consider work and have other opportunities. So I'm thinking Fiona might pick up on that later. She's nodding, so maybe we'll leave that for later discussion. Yeah, great.
Yeah, happy to leave that. I suppose that was another space we didn't actually model the costs on, but we assume that the reduced there would be a reduced need for unpaid care. There might be families would still choose unpaid care options and things, but with the reduced reliance and lack of choice, there would be options that I'm sure Fiona will go into a lot more detail on, in terms of being able to still access work and that sort of thing for unpaid carers.
Okay, thank you. We've got a question, it might be our last question before we go to the break. Any thoughts on social prescribing services to support or even divert people away from the front door of social care? That might be a broader question for later, but I'm
happy to give a couple of thoughts just now, and then we can come back to it later. I suppose saying social prescribing as having a merit of its own, rather than being something to divert away from or ease pressure on social care support. So social care support should be there for those who need it and need to access it. But social prescribing has its own value and should be used for that, and people could be able to access both, but not use it as a way to divert. I mean, in terms of where we're looking at greater investment and the ideal scenario of having the care there and accessible, that's what we'd be looking at.
Great, thank you. Thanks everyone for your comments. I see Wendy's put something in there. Thanks, Wendy, around people with disabilities. So we'll have a look at that and pick that up in our next bit of discussion. We do have a short break, so we'll come back at just after 10 past, if that's enough time for people to get a comfort break. And then thanks so much, Sarah. Lots to think about. And if you're having discussions with, and I really welcome, we've got a few of our Health and Social Care Partnership colleagues in the call, so we can follow up our discussions. I'd like to welcome Fiona Colley, Director of Policy at Carer Scotland. Delighted to have you here, Fiona. Thank you for joining us in a very busy schedule. And I'm going to hand over to you without wasting any time to share what's happening at Carer Scotland and your insights relating to the transformation of social care. Thank you for joining us.
That's great, and hopefully I won't be as long as scheduled. I don't have any PowerPoints. I very rarely use them because I forget about them. So what I'm going to talk about is just a bit about the picture just now for unpaid carers, and also around some of the things that can help. To me, it's all about value. And what we want to see for ourselves and the people that we love. I mean, I think when we think about that, we want to be nurtured, to be able to fulfill our aspirations, to have friendships and connections, to be able to work if we want to, and to enjoy our lives. But too often these things seem unattainable and seemingly impossible for people with disabilities, older people and carers. And to me, it's not because they can't be reached. And I think Sarah set out, you know, we can do this, but they're simply seen as too costly. And the people who are affected and their carers are simply not seen as sufficient value. And I think, you know, that's something that we need to talk about how we value people. For carers, they're a resource to be drawn upon, so they're another worker to be drawn upon, and disabled and older people are just seen as a cost to be borne. But the reality is our lives can change overnight. My mum was a carer for my dad, and when I was 6 years old, he suddenly collapsed, and for the rest of his life, he had disabilities. I think my mum would probably have been about 30 then. And that's certainly not what they had planned for their life, but that's what happens. And too often overnight, someone can become a carer. It may be more gradual, but the reality is 3 in 5 of us are going to be carers at least. And that includes probably everybody who's watching this just now. If you've not, will have a caring role. And so it's about all of us and about how we value the lives, not just the lives of our families and the people that we love. The independent review of adult social care talked of a need to think of social care differently and about stop seeing it as a burden and actually an investment in our economy and society. And we do need to be more ambitious, as Sarah's outlined, and probably more ambitious than the National Care Service. And we really don't want to see it delayed and delayed and delayed and delayed further, because ultimately this comes from the independent review. This is what people who use services and unpaid carers told government what was needed. And we have to recognise and respond to that. Yes, it will be challenging. There'll be bumps across the road, but we need to start. We can't allow it to be delayed indefinitely. It is a good shift in how we view social care, and I think the principles in the legislation are very important. But if there's not enough money in it, it's going to fail. So we need to do it properly. But fundamental for carers, that change is critical in enabling them to thrive. And I think we've heard quite a lot from ministers about thrive, not survive. And I think they're quite keen on this buzzword. But that's the reality. We want people to thrive, people of all ages to be able to have good lives. But there's a huge gap between warm words and effective support. So I wanted to give you a few examples. And these come from State of Caring. And this is an annual survey we do of carers, which really gives a snapshot of a particular point in time, and we've carried this on for over a decade, and in 2022 over 2,000 carers in Scotland responded to it. So some of this is from what they told us. So hospital discharge is a good example. It's an area of political argument and media headlines, and using which is really dehumanising the term bed blockers. But often this is the point where carers are thrown in at the deep end of caring, and without the right support, it's a huge impact in their lives. When we ask carers about hospital discharge, nearly 2/3 were not involved or consulted, and only 15% were given any choice about providing care. So basically, that's it. You're providing care, and few get any support they needed to care safely. Less than a fifth said they received sufficient services. In the middle of a cost of living crisis, over a third said this meant they were pressurised to take time off work to care, creating or exacerbating financial insecurity. For some, that meant they had to leave work altogether. All of this despite the fact there's already legislation in the Carers Act that says they have a right to be involved, and the NHS has a duty to involve them around hospital discharge. It seems when hospital discharge happens, NHS bodies are avoiding their rights by simply not asking the question, are you a carer or are you willing or able to provide care? But it's not just as hospital discharge that carers are not asked about the support they need. Less than a quarter of carers in State of Caring had been offered an adult carer support plan, which is the key route to support. And bear in mind, our survey is more likely to touch upon people who have some awareness that they are a carer. And there are thousands of people out there who don't even know. And to give you a figure, roughly 1,000 people every day in Scotland become carers for the first time. 1,000 people, and around slightly less people stop their care enroll. These are a huge group of people that need support and need the right information at the right time. For those the lucky ones who've actually had an adult care support plan, 8 in 10 said it did not consider the support they needed to juggle work and paid employment. For those currently in paid employment, around half said that they weren't asked about support they needed to maintain their current job. So throwing more and more carers facing the choice between providing care or having employment. And that throws more and more carers into financial insecurity, again, right in the middle of a cost of living crisis. But that's not new. This has been a pattern that's continued over many, many years. But the cost to carers continue. Only about 40% of assessments considered carers' own health and well-being properly, if at all. This is despite it being well evidenced that carers are more likely to be in poor physical and mental health than non-carers, with even greater levels of poor health for those carers living in areas of deprivation. Carers are more likely to have a long-term health condition. and 16% more likely to have 2 or more long-term conditions. So caring has a cost to health, and there's a cost then on the health service. And worryingly, only about half of carers in their adult care support plan were asked if they needed a break, and only 40% said they'd had a break in the last 12 months. So can you imagine being told that actually here's your new job that you didn't really have a choice on, but we're not even going to ask you if you need a break, and for a whole year you're not going to have any time off, and that's the reality for unpaid carers. But the biggest contributor to all of this is the lack of services, the lack of social services, or the lack of the right services. 1 in 4 carers said the services that were there didn't meet the needs of the person that they care for. And nearly 1 in 10 were told there was actually no services available at all. And in rural and island communities, that number was nearer to 1 in 5. So there's huge unmet need there. But the issue of information and cost is an issue as well. So almost a third don't even know what was available. They weren't told. And 1 in 5, and I think this is an important thing, because as well as the cost to carers, there's a cost around social care charging. And 1 in 5 said that they didn't use services because the costs were too high. And for those who were struggling to make ends meet, over a quarter said that was a barrier. So actually there's unmet need because people simply cannot afford or are making a choice that actually in the middle of a cost of living crisis, when you're trying to heat your own home, social care service charges are a real barrier to getting the support. And that shouldn't be a choice that we're asking people to make. Talking about costs, I have to talk about poverty, and when I was analysing the responses to state of care, and we have lots of points where carers can make comments, and you can have the raw data that says, you know, people are struggling to make ends meet, and the level of people who, for example, were in fuel poverty. But actually, when you listen, you look at the comments of what people are telling us about having to sell things to be able to heat their home, about running out of all of their savings, about using credit cards, about borrowing from friends and families, about food banks, and that is all about because they are providing care, and because they've not been asked, and because there's a huge gap between what is needed in relation to social care and what is there. More than a quarter of carers in that survey said they had to cut back in food and heating. And, you know, I'm sure we're probably all in agreement about how we feel about the current cost of living crisis and the huge impact it's having on individuals, and particularly the poorest in our society. And 1 in 10 carers are using food banks just to get by. I want to talk a little bit about employment, because there is a direct cost to individuals, but also there's a cost to the economy as well. So many carers do struggle to juggle work and care because of lack of support. Now that can be lack of support from social care, but it can also be lack of support from their employers, and that is a reality for many carers. Nearly 7% of carers are forced to give up work to care, and a further 5% are reducing their working hours. And a similar proportion simply can't take up paid employment because of caring. And that's got an economic and personal cost. And there was an analysis in 2017, and there's not a lot of analysis around this. And I think sometimes these are some of the things about looking at gaps and how do we bring that evidence to the table. But it was by the London School of Economics, and it estimated that 345,000 working age carers who'd left work and remained out of employment had public expenditure costs of £2.9 billion in taxes lost, earnings and replacement social security payments. So that it's trying to bring those figures and bring them along with the excellent work that the Scottish Women's Budget Group has been doing, because again, it's about value. If you value care, it brings so much to the economy if you actually do the right things. But employers are in losing talented people, and they've invested significant time and money into them. And because of the peak age of caring, which is 45 to 54, they're going to be the most experienced employees. It's difficult to replace that. It's expensive to replace that. And I think in the current economy, the issues of workforce across all sectors and being able actually to even employ people are very challenging. But it creates a huge financial penalty for carers themselves. On average, carers who've had to reduce their hours lose out on £6,300 a year. And that's a massive amount of money to lose to your household. I think I wanted to talk a little bit about some of the steps that we can take. And some of them are actually really practical things about asking questions. So for in the health service or in other settings, your GP, community, etc., is ask the question: Are you a carer? Are you willing and able to provide care? These sort of questions. What's your life looking like? And an absolute additional training around in the NHS. And I don't doubt the pressures that the NHS are under just now, but you simply cannot just transfer them over to unpaid carers and say, here you are, this is your responsibility. And it doesn't matter the impact on you. So you need to ask the questions. We need better systems that refer people for an adult carer support plan or a young carer statement. And there's gaps that emerge because carers don't know, services don't know, and there's no referral into having that happen. But also they need to be of value. We also need to assess properly. Carers are complete people with full lives, and it's a must, and I'll say it more times than I need to. It has to have a focus on carers' aspirations and opportunity, and that includes sustaining or returning to work, education and lifelong learning, improving health outcomes and building social connections. Carers must have a right to work and to education. But this won't help until we have the level and variety of services we need. So government needs to take action on that. And that includes on the terminology I think is market facilitation, but actually to develop the kind of services that people need. Ahead of the National Care Service, and I think that was the thing about saying about not delaying, there is a right to the proposals to have a right to a break from caring. Why do we need to wait for a National Care Service to do that? The answer is we don't. Equally, removing social care charging. Why do we need to wait for a National Care Service for that? The answer is we don't. So government can do that right now. There's more clear actions around carers' health for employers that all public sector bodies should be carer positive, and those receiving public contracts should be required to do. So it's actually about ensuring we create the environment for carers to remain in employment. There's a number of areas around carers' income, but we need to bring that together in a carer poverty action plan and make sure that everything that we're developing across a range of areas is actually going to address that. And Sarah earlier mentioned the national outcome on care. And if you don't value something, what you can't see, you don't value. And that's been the issue around primarily women's work for so long. Is basically if government doesn't see it, it doesn't include it in its programme for government. It doesn't include it in the level investment that's needed. So I think I'll say some final words, and the question really is not what the cost of creating transformation is, but rather what the cost of not doing so. And I think my point would be the cost is too big, and it's already too big for carers. Thanks. Thanks,
Fiona. Some really powerful insights there, and it really struck me when you were saying, you know, carers have full lives, and I was thinking a lot of the people I know they may like to have, but their life goes on hold to do that caring. And as you say, there's a right for carers to have a full life, to have a job, to have opportunities to education and other opportunities. So that's something I've written down, thinking about employability. And I know carers are part of that, or should, you know, they're a highlighted group within that bit of work. So something for us to think about. Thank you so much. There's loads to think about, but I think in amongst some really significant issues and figures that are really grim for people's lives, there's also quite a few things. I started writing down, what can we do? And there's quite a few things that I think we can do. And we talked about this, as you've just said, Fiona, when we had some of our events last year around the National Care Service. It's like, why are we waiting for a bit of legislation when we know what the right thing to do is right now? Mm-hmm. So what are some of those things? And I'm thinking, you know, colleagues that are here who are really welcome within our Glasgow work within the Health and Social Care Partnership. I know there are opportunities for us to have discussions about that, and hopefully all of you from different places will be able to do that as well. But that information sharing, so what is available that might be able to help people, that asking the question, you know, what do people need, how do they, are they a carer right now? The charging issue, it kind of floats around, and I'm not sure if it lands anywhere, and that might be my ignorance, but I'm going to go away and think about that a bit more. What, you know, that charging is getting in the way of people's getting their basic rights met if they're put off. And I liked what you were saying there. What's the gap? What's needed, and what is there? And are we clear on that? So thinking about some of our work in Glasgow about that. Also Scotland That Cares, Sarah mentioned that, to go and maybe have a look at and sign up to what's happening there. And that carer positive, so there's already a process there in terms of good practice about being a carer. So a few things I've noted about what we can do. I'm just going to try and multitask a bit better and see the chat coming in. There's something about carers' rights to employment. A question from Wendy, Fiona, do you know of any links being made to employability strategies and partnerships in terms of workforce plans?
We've started some work in relation to employability. There's actually a lot of the local employment partnerships. There's actually a lot of activity going on out there, but the fact is that often carers simply don't know about it, you know, that's the first step about making sure that carers do know about it, and it's something that we're actively talking to government about. One, about carers having the ability to access that, but also the reality is that employability shouldn't just be at the end of the caring role, but it needs to be something that's brought in when people want to get back into employment. So it needs to be tailored to be able to consider social care as well. It's such an important element of it, because if it's a bit like childcare, if you don't have the right childcare around you, it makes it very difficult to necessarily make the changes that the choices that you want to around employment. And Is it exactly the same? It's probably pretty much exactly the same. If you have the right services around, then you have the opportunities and the choices that you want to have. They're not constrained by the lack of service around you.
Thanks, Fiona. There's something going on with my screen. I was thinking as well, you talked about you know, the carers that we do know, and that's something we talk about in Glasgow quite often, that there's a lot of carers that we do know about who're engaged with the system somehow, and they think of themselves, they identify themselves as a carer. So what about the people who don't yet? And I thought that was a huge figure you said, was that right? 1,000 people a day who are becoming carers for the first time in Scotland, is that right? Got that right?
That's right.
Yeah. So what about them? Is there something we should be asking or thinking about for those people?
Yeah, I mean, certainly it's probably an issue that we've, you know, I've worked with Carer Scotland for 20 years, and it's an ongoing process to try and help people identify themselves as carers, because often that's not what you see yourself as first. You might eventually, but you just see yourself as, you know, like my mum, I would just see myself as a daughter, and you know, this is just, you know, this is just something I'm doing. But actually, if individuals are able to identify themselves earlier, that they can access what support is available, particularly where there's financial support when people drop out of employment. But there's a big role for the organisations that touch them. So the NHS is critical to me, that actually enhancing and bringing on more training in relation to those people who are making decisions around discharge, who are having the conversations with families, that they can actually talk to someone about what this could mean, and that you can where they can access support. And that might be your local carer centre. It might be a phone number. It might be so a helpline, or it may be a direct referral for an adult carer support plan, because there will certainly be some carers in those positions where you know from that it's going to be it's going to be a fundamental change, and actually that point of getting support as early as possible. And you know, we've got a bit of worry about that. Well, a lot of worry about, you know, during the pandemic when families were not allowed into hospitals, or very, very limited later on, is a lot of these conversations didn't happen in the way that they perhaps should have. And is there and it's a question I'm not sure I know the answer to, but a significant number of carers who've not had support, and may continue not to have support because they haven't really touched in with the things that should have happened at that point. So it's to me, the NHS is critical as part of it, but actually, you know, it's something about the public awareness as well. And the government has done some campaigns, but to me, it needs to be something that's a consistent, all the time happening, that we're actually talking about this. And I certainly think that over my time with the organisation, I think people are more likely to recognise themselves now, but there's still a big gap between and some people it can take 5 years or even decades, and they never recognise themselves until an off chance conversation, and more often than not that's with another carer who's the person that shares the information. So that was a long way round talking about it.
Thank you. And I know an example locally is when people call health and social care, you know, there's now a set question or an immediate you know, response for people to ask about their caring. But again, it does need people to recognise that, as you say, a lot of people are just doing what they're doing for their loved ones. So I guess a bit of awareness about how we have some of those conversations. I'm not in a smoky room, just to reassure anyone that is concerned.
You're very mysterious.
I'm clouded by all the information I'm receiving, but we've got 5 minutes to sum up and I guess think about anything, you know, the what next. And I'm thinking, Lynn, we've got a session coming up around with Dr. Anna Dixon, who was involved in the Feely review, but co-chaired the Archbishop's review of social care in England. And it really had me thinking about that, some of the conversation earlier about what they are proposing. And it's not got the figures and here's how it can be done that Sarah's given us, but it's the compassion, the values, and that's really come through today. You know, if we really want to value people, and I don't know anyone in the space that wouldn't want to, so what's getting in the way of that? So any final things for us to consider or to take away, anything that you haven't had a chance to tell us, Sarah, or are you happy that we've got all info we can share with people after?
I suppose the research that we've done on this can feel like it is quite focused on numbers and calculations, but I think it is what you were just saying there, Sheena, about the importance of recognising, and what Fiona's emphasised, the importance of recognising. We've put these figures together because we need to value care, and we hope that they can help advocacy efforts and discussions around what valuing care means in terms of the actual investment we're looking for. But this should be part of a wider understanding of what we want to value in society and in our economy. So when there's a lot of discussion around the wellbeing economy in Scotland and what that means, really making sure that care is understood in that discussion as well, and that value in care for people as well as planet is part of that. And so I think there's other spaces beyond the really nitty-gritty kind of National Care Service discussions and that sort of thing, where we can bring up the need to value care and the need to invest in care. And so any conversations that people are in like that, events that you go to, that you're able to highlight work that's being done around care as well, so that it's incorporated into these kind of concepts related to the economy, I think is really, really worthwhile, so that care isn't seen as this thing on the side, but it's integral to what we want to value as society and economy.
Thank you. Thanks very much. We do have some discussion going on with the Scottish Government, so we'll be able to refer to this, and we've got some work with them, with people that haven't been engaged with well, or whose voices are not always heard. So we do have those opportunities, which is really, really positive. Anything, Fiona, from you before we just finish up?
I think probably emphasising the long-term impact and the long-term cost. When someone's has a caring role, and that long-term impact will have an impact on them individually, but also in relation to that the sort of economic cost, because when someone has a caring role, they obviously can lose earnings, they can lose opportunity, and may have significant extra costs as well, drain their savings. But actually, when you get to the point of retirement, we know that less than half of carers will be looking at having an occupational pension that they can rely on, and that's what carers told us, that they simply didn't have anything like that. So actually, the cost then goes into their old age. And if you want to look at the associated costs with that, is a cost in the benefit system, because the state will, the state will have to top that up. So there's a long-term cost. It's not just about that point in time when someone's caring. It can be a long-term cost to them and the economy.
Yeah, thank you. And I noted, I think it was Sarah said something about long haul efforts. This isn't a short-term issue. It's been years of underfunding and undervalue, so it's a long term, and that impact you're talking about goes on and into people's whole lives, not just a snapshot of time. So really important for us to think about that. Lynn, anything you want to say before? Oh, sorry, I did notice Susan, thank you, put something in about skills and the recognition of carers. And I think really important, there was people talking about that last year, just about all this skill and knowledge and it goes unrecognised. Susan, is there anything you want to say about that or add to what you've put in the chat?
Yeah, I just work for a Scottish Women's Convention, and we hear from women all the time that they've had to go to work part-time just to care for a family member, whether that be a child, whether that be a parent. But the skills that they learn, they're not seen as transferable when they go into that job market. It's almost as if they've got a blank in their CVs, and it's harder for them to get a job and get paid the money that they deserve to be paid for doing that. So there's that inequity there around about the pay that they get after that. Also, with regards to the pensions, as Fiona was saying, we're told by women all the time that they may opt for part-time so that they can try and balance both, to try and have some adult time and a break from the caring, but also bring in money to actually offset what they don't get for the caring role that they do. And that affects them later on in life when their pension pots aren't there and they've not got the money to do the things that they thought they might have been able to do free of that caring role. So these are huge issues, and it affects quite a lot of women, and they tell us this and like every time we go to places and we have conferences and stuff like that, that the inequity of it all, because that caring responsibility is seen as a women's issue predominantly, and it just has major impacts on them for the rest of their life, but they feel as if that is their role to do that. And I think that's very unfair, and I think it's something that needs looked at, even ensuring that when they're doing those skills, they can get a qualification for it, knowing that they're doing that so that they've got something, so that actually when they are able to go into that job market, they can get a better job at a better rate of pay to actually top up these pension pots and things like that again.
Thank you. Thanks. Lots to think about. We're at our time though, so I feel like there's quite a lot we can take forward. Thanks, Lynn, you've put the Health and Social Care Network. I think there's a few themes emerging here that we could maybe have future discussion, and thanks for everyone's contributions and sharing of info. We will collate that and share it with people afterwards, and please do get in touch with us if there's any points you want to follow up on. A huge thanks to Sarah and Fiona for their input, and for Lynn for getting us all here. Thank you as ever. And yeah, look forward to following on some of these discussions. Thanks very much, everyone.
Thank you.